What? Can you bring it? Bring it. Which is length it is? I want. Bring it. Bring it. Bring your phone. English buste barchena. I want. Bring it. Bring it. Bring your phone. Buste barchena. I want. Bring it. Bring it. Bring your phone. Wait. Whether it is back camera, no? Okay. You control it. Sit there. You do this one. You control it. Sit there. You do this one. Keep. Whether the screen is coming like this, you check it. Whenever I'm coming, screen is coming. Like this only coming, no? Like this, you check it. Whenever I'm coming, screen is coming. Okay. Somebody is online. If you want to ask any question, you can ask me. Okay. So you have this one with you. This is yesterday's class. What was my last class?
National health policy.
Community health nursing, right? Community health nursing. We are seeing about the national health problems. Okay. What is health? Health is a
state complete physical, mental, social well-being.
Not merely the absence of disease and infirmity. Okay. What is the problem? Health problems are classified under 5 heading. Can you tell me what are all the heading we have classified? First is the communicable diseases. Then will be the non-communicable diseases. Next is the nutritional problems. Then environmental problem. Then will be
population problem.
Population explosion problem. This is the country's important problems. So first one is a communicable disease problem. In the olden days, communicable disease problem, most of the people were dying. Now currently, even a school have a non-communicable disease problem. We are shifting a trend. What is the trend we are shifting? From the how we are shifting? Because we have found out the 6 killer disease. Now we are including EPI immunization program covering even 12 communicable diseases. So communicable diseases are declining and non-communicable diseases are increasing. It is like an iceberg. It is like iceberg. It is the tip of the ice. Tip of the ice. This is the structure of a non-communicable disease. Here what's happening? This only non-communicable disease are shown. Then inside it is underdiagnosed. It's not even diagnosed. Many people are there. In our country, most of the non-communicable diseases are in the state of undiagnosed emerged condition. It is there. So that is the communicable disease problem. In the communicable disease problem, NGOs only played a major role to find out the communicable disease problems in the beginning. As well as the non-communicable problem, if you take blindness, all the NGOs only come forward to find out the keratomalacia or iron deficiency anemia. If you see the history from the beginning, it was 1941 after MOH, Ministry of Health and Family Welfare. It was not MOH, it is only Ministry of Health. Then Family Welfare separately. Then they made Ministry of Health and Family Service something. Then they made it as a Family Welfare. Then it took long time to come. By the time MCH program come, RCH come, CSSM come, that is the history. Every time either the population problem we are controlling, either the communicable disease problem we are controlling, all the programs we are making so many goals and all these things focusing upon IMR, MMR maternal mortality rate. If the mother and the children are good, the family is good, country will be good. So they found out that lot of the people are dying mainly for anemia. So then after words you could see many anemia control programs started with the schools. So why I am telling, when you are seeing the problems, you should know the solution. So okay, the communicable disease. Can you tell what all the communicable diseases are striking in India?
HIV, AIDS, malaria,
PEM. What is PEM?
protein energy malnutrition.
Now currently you can add it as a nutritional communicable disease is a PEM?
No, ma'am.
I am asking about communicable disease. You are telling nutritional program. You are telling nutritional problem, right or not? PEM is a communicable disease?
No, ma'am.
I am asking about communicable problems hitting our nations. What is that? HIV,
malaria, AIDS,
malaria, tuberculosis, all these things. Even in 2002, we have made a national population policy to control zero AIDS by 2010, but we cannot. Still, HIV, Kala Azar, we cannot control. So all programs or we are putting a goals, cannot achieve it. As you told, malaria, cholera, dengue, typhoid. So these are all communicable disease. You can remember like vector-borne diseases also more. Which vector is playing a main role? Mosquitoes and the flies. Kalas are some things and fly are causing these kind of disease, but mosquito playing a vital role to disease, communicable diseases. So non-communicable diseases, as you told, what you told, non-communicable diseases.
hypertension, diabetes mellitus, breast cancer, oral cancer.
Yes, anemia also you can write it. There is a question asked by me, asked to me some other people, because I took anemia is the adolescent anemia I have taken. It has got a great impact, but still in 54 to 60% of the adolescent children, both male and female children are having anemia. We can't control anemia because of the junk food. You know what is junk food? Trans fat is there. Burger, pizza and kurkure and chips and lays or much they are eating. It is going to the kind of the fat, it is called the trans fat. So the shifting trend from the communicable diseases to the non-communicable diseases to the children, the obesity, cardiac diseases. So many children in the age of 13, 15, 16, they are getting even a cardiac arrest. So that's what the studies are telling, shifting trends from the communicable disease to the non-communicable disease. That's why our trend in community health nursing, preventive aspects to the promotion of the health. Clear? A nutritional problem, PEM, you told me. Goiter, marasmus and obesity also you will be controlled. Malnutrition. Why? How do you find out malnutrition? If it is male, you will. There are various Glasgow-Coma scale is there. Glasgow-Coma scale for that. Sorry. What is no Glasgow-Coma scale for morning I took brain. Brain is a Glasgow-Coma scale. Brain, not this one. Gomas classification. He is not a Goma scale. Gomas classification. This Gomas is the person talking about the expected weight, actual weight divided by expected weight into 100. So actual weight divided by expected weight, you went to community, you know, no? Age in year plus 2 into 2, that will come age wise. If it is adult, what is the way? What is the calculation you will do? BMI. What is BMI? Body mass index. How do you? What is the formula you will be telling?
Height
in what? Height in? Height you will put or weight you will put? First will be weight. Weight divided by height in meter square. Okay. Weight divided by height in meter square. If you 70 kg or 160, 1.60 the whole square, then it will be coming. Then you will have a middle, moderate, severe, mild, 18 to 24, normal, less than 18 is a malnourished. These are malnourished people, like that you will be. So this is all nutritional problem. To overcome this nutritional problem, government had lot of nutritional programs. Can you list down what are all the nutritional programs in India? Iodine deficiency control program,
Yes.
midday meal program, vitamin A, correct or Malaysia? Vitamin A deficiency program, then UNICEF conducting applied nutrition program, right? Then ICDS, you know what is ICDS?
Yes, ma'am.
Integrated Child Developmental Scheme. Under that, who are all beneficiaries are there? So the government is looking into all the beneficiaries. Beneficiary mainly pregnant women, under 5 children, then adolescent girls. Who will be taking care? Anganwadi worker, Balwadi worker. Every 1,000 population, one Anganwadi. They have education, they have brain development program, education, growth and development. Growth chart is maintained.
Yes.
Gobi, you have to know what is Gobi. You are all going to write exam. Exam, growth and development, oral rehydration therapy. Like that, the Gobi full form you have to know. Growth monitoring, oral rehydration, breastfeeding. Yes. Okay, that and all you have to know. So that is a communicable disease problem, non-communicable disease problem. Then will be the nutritional problem. Next one will be the
Environment problem.
environmental sanitation problem. What is environmental sanitation problem? What is environment? What is environment? What are all the types of environment? What are all the types of environment? Physical environment?
This bus is creating many problems because the time,
Coming late.
Yes, ma'am.
Timing is not matching.
Today microbiologists I can't come.
Microbiology.
This time is not fixed.
Okay, tomorrow we'll discuss with Mustasta. One of you stay here and discuss.
Ma'am, our timing also reduced, so we have classes and syllabus to cover.
Okay, I'll discuss after the class. You see the committees, SNA committees? Start write the file. We have to register the students with the SNA and TNA. Okay, what we are discussing?
Environment.
What is the different kind of environment? Physical environment. In the physical environment means what are all the physical environment is present? Physical environment. Air, water, radiation, pollution. You have studied in the primary. Like if a water is problem, waterborne diseases will come. If it is a vector vehicle, water is the problem vehicle. Food is another problem. So 5F are there, prevention of the communicable diseases. What is this environmental control can done by the 5F? Can you know what is 5F? 5F, disease prevention. 5F, food, fomate, finger, flies, feces. This 5F you have to take. Food, write down. 5F are food. Whatever the food you are taking, cholera, dysentery, something. Fingers. If the fingers are not clean, there is a lot of microorganisms are present, germs are present, tapeworm, eggs will be there, it will go and multiply it. Then next is food, finger, flies. Flies will be causing the cholera, dysentery, because they are sit with the defecated one and coming. Then will be what is that? I told you food, finger, flies, feces, fomate. Fomate. F-O-M-I-T. In Bengali you can find out what is the fomate meaning. So these are all the environmental problems. So environment has to be very safe. What is happening in Delhi? Delhi is choking. What that is, you have an environmental indicator. What is the indicator? When the inspector comes, where is the certificate of the pollution control board? certificates we have to get. Hospital should be getting pollution control board. Hospital or the college, water pollution. You are lot of people are staying. I cannot give the water directly to that one. It should be the treatment plant should be there. So every individual have a responsibility to take care of the environment. Every institution have a take care of the industries are there. Put dyeing industry, put the dye into the sewage water or dye into the river water. Somebody is drinking. In West Bengal, all the pond, one people very dirty looking green color water. Someone is washing, someone is cleaning, someone is taking and cooking. Water is a big vehicle and algae is present over there and then pigs are present over there. Ducks are there laying eggs, putting the shit, and people are not taking bath in that, drinking that. Mosquitoes are breeding inside that. There are different mosquitoes are there. Plasmodium, like many mosquito, female, Anopheles mosquito, Aedes mosquito, Culex mosquito, Plasmodium vivax. So many mosquitoes are causing these Aedes, they are the green water, they create dengue. Culex mosquito preventing elephantiasis. You might have seen the people, right? Open drainage. So that who is responsibility? So the government, individual and the people are responsible. So that's called the physical environment. Spray putting, coconut shell, tire. So that's called the environmental health. That what we are doing, we are paying the tax to this one. That's what you are learning the first unit, health administration. Where the tax is coming in the administration level, in the municipality, what all the sectors are there present. Health sector, sanitation sector, sewage maintenance sector. So many sectors are there. Health and management sector, under that hospital, primary health care center, others are coming. Sanitation sector where their cleaning board and other one, and electrical city, electrical wires and electrical current supplies are the communication sector, they coming. So these are all the sector. Collector will be the person will be there. So where the money is coming, that's where the money is coming. How is doing that? That's called the health administration we are doing. Mainly those people will be focusing on the problems of our country. So the nutritional problems are, we are bringing nutritional programs from the budget. Yes. And then we are solving the problems, and nutritional deficiency, anemia is playing a vital role. Now the male children also, WAFA, weekly iron deficiency, iron supplement program, iron and folic acid supplement program. Even teacher also has to swallow the tablet in front of the school, government school. Deworming program, Indradhanush program, vaccination program and deworming program. Indradhanush, what is Indradhanush? It's all communities just related with one thing to the another thing. You might have seen committees are there. You might see 5-year plans are there. You might see another program. So if you see the history, one program, family planning, family welfare, MCH program, then RCH program or CSSM, one program not neglecting anything. One program if you take CSSM program were there. When RCH package has come, RCH package will be taken CSSM as a one component. CSSM, client oriented approach, control of RTI, STI, family planning. What you see, we started with the family planning program. Then it started with the family welfare program. All coming under RCH package. Then we divide the RCH package into 1 and RCH package 2. It's merged with the NRHM. Clear? So in this side it will go. Then 5-year plans are coming. From where the first 5-year plan started, 51 like that. Then many committees also started. Board committee started 1940. Board committee 5-year plan. Board committee 5-year plan going. Board committee, Mudaliar committee, Sada committee. Sada, they have taken, see, board committee if you take, they have given a clear report about the school health is not so much good. They have given clear report. And 1909 they give the better, what all the recommendation they made it. So one chairperson will be there. Here they put the seed of making a primary healthcare center in a beautiful manner. So that time also 1:40,000 population, then slowly it reduced to rural and urban. That's all covering population of the primary health. one person wrote. What is the covering population of PHC? One wrote adult, child. This is not the covering population. Covering population monkey, donkey, dog. It's all human only. One PHC for how much population? Rural area is how much? Urban area is how much? That's what it's called, the administration. Health administration. That's what is going on. So what you have to do, then one program is merging with another program. Another program, and NRHM has come. So Mudaliyar board committee has come. Short term goal they had, long term they goal had. Mudaliyar has come. Mudaliyar committee 1 and Mudaliyar committee 2 it has come, dissolved in only 1 year first. Then again it got, then Sada committee came. Sada committee also, what happened? Lot of problems with mosquitoes, malaria, dengue. So one health worker is to 10,000 population. It's very difficult to take care of the antenatal, that family planning, family welfare, everything with the dengue. So what happened? Next, Qatar Singh committee has come. They have taken a multi-purpose health workers. The one cadre is created by Qatar Singh. Because the problem of Sada Singh, every problem in the country, we are learning the new thing, we are implementing. Community is the ocean, but it is connected with each other. What happened? Then they multi-purpose health worker, who bring it? Qatar Singh. Qatar Singh brings the multi-purpose health worker cadre. Okay, Srivastav committee. They have done some education, so many revolution has come. Right? High power committee. High power committee given a lot of regulations about the medical professionals. So what is that? What is their rules? What is their duty time? How is the leave has to be maintained? Like that each committee has come. Then who and all bringing those committees? Committees are bring by the Planning Commission of India. This Planning Commission of India, there will be 3 persons will be there. Who are them? Program advisor, technical advisor, general secretaries and chairperson, deputy chairperson and members will be there in the Planning Commission of India. What happened after Mr. Modi come here for the taken a charge? Afterwards, Planning Commission been dissolved. 5-year plan is dissolved. The last 5-year plan is 2012 to 12, 13, 14, 17, finished. That is the last 5-year plan. They brought a 15-year plan like that. Now what happened? They brought the Nidhi Aayog. That is a very, very important. All the resolution, all the things taken place by our national health problems in India, keeping in your mind. In a community, there is a community development program. There is a community health program in a distinguished way. HR-led community development, 100 days working scheme. Community development, Ujjwala Yojana, community development. Health, family welfare Yojana. Family welfare. For the women, what is the program? Children, what is the program? Right? There are many programs, no? JS, Janani Suraksha Yojana, Shishu Garyagram Yojana. Jan Dhan Yojana. Jan Dhan Yojana, it's a community development, economical development. Economy and the health are related with each other. Purchase power is increasing. So, sub-committees dissolved. Sub-5-year plan is dissolved. When I was studying, it was by 1997-93 I joined. They told health for all by 2000 AD. Within 2000 we will, then it is over. Then it came with the Millennium Developmental Goals, Sustainable Goals. Now what happened? Nidhi Aayog. Nidhi Aayog is a kind of a sustainable developmental program. In the Nidhi Aayog, who is the chairperson? How they are doing? Did we achieved in a separate class? I will take it. What is the mere 20 points? Who is the chairperson? Only chairperson is Mr. Narendra Modi and he is keeping the members. What is Nidhi Aayog? National Institute of Transformation of India. We want to make a digital India and our working culture should be industrial work and generalization. Main 5 points they are giving And strategies has been 5 strategies, 20 points, 131 targets. Whether we achieved or not, separately I will discuss it.
Okay, ma'am.
So the root base is the health problems in our country. The biggest another problem is the demography. It is called the population. Demography alone we are studying, demo and graphy. Study upon the population. There is a population cycle, high stationary, low stationary. In the high stationary, high birth rate, high death rate. Then the middle stationary, like that every time birth will be going and decline, going and decline. That is like a cyclic formation. Birth rate. When that is a life expectancy was only 60, 50 years. Now life expectancy, all are living for 75 years because of sophisticated healthcare services. So what is this demography is telling? Along with the demography, you have to study about the population. Even you have to remember either the population policy, either NRHM, either NUHM, RCHS, MCH, all the goal are going to be the same. Reduction of IMR, reduction of MMR, reduction of neonatal mortality. Yeah, this mortality, morbidities has to be completely reduced. In addition to that, there are different approaches they are following. Before what happened? Only health education approach, primary healthcare approach was there. Now currently triple P approach. What is triple P approach? Public private partnership approach. I have a digital health card by the government of India. Mr. Modi brought there is a health card. What is the name? What is the Abhiman? There is a one health card available, na? Huh? Along with that health card, digital health card is available. No. Abhiman, what is that they are telling? What is the name of the health card? Orange color card that you have to, this one, your digital health card, you have to enroll it, even a 5 lakh, that what? Central government health card, digital card, it is making, then even 5 lakhs rupees they are giving, even you go to Dishari health points, you can do some surgery, neurosurgery, government will be paying. This is all are doing.
This card is not valued. In West Bengal,
Central government card is not valid. Ayushman Bharat.
only Shastri card is
Okay, that means it's a local central government card that Didi is paying for your government. Maybe Didi is angry with Modi, so that card is not available. That's called Ayushman Bharat. The card is called the Ayushman Bharat. But in our hospital, we are doing a public-private partnership. So what's happening? Rather building 1:20,000 primary healthcare center, making a public-private partnership, Vande Mataram scheme, many things. So in the logo put it, government will provide maternal copper tea, Maladi, Malayan, they will get it. So that's called the public-private partnership approach. So this is the approach. So if you see the history, everything with the national problems.
Yes,
5 more question will be coming. You have to write in detail about the communicable disease, non-communicable disease, nutritional problem, then environmental health
problem,
and the population
problem.
Clear?
Yes,
Nutritional problem solved by the nutritional program in India. Environmental health problem, communicable disease problems solved by the communicable programs in India. Yes, who is that? Cut it. Okay, non-communicable disease controlled by the non-communicable diseases control program, blindness 2020 program, all is coming. Okay.
Yes, ma'am.
Okay, today we will see about little bit different topic. Just I will tell you, and a separate video is there. You can see that one. That is called rehabilitation. What is rehabilitation? Rehabilitation is a medical, psychological, social measures to train and retrain the individual and helping him to restore the maximum potential of his health. Maximum potential of his health. Before that, I would like to ask you one question. Can you tell me what are all the levels of preventions?
Primordial, primary, secondary, tertiary.
Primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Primordial prevention, what we will be doing? Health education, vaccination, mask, same thing, primary also. Then you will additionally yearly identification, yearly notification, yearly screening, yearly identification, yearly screening, yearly diagnosis, right? Then yearly, what is secondary prevention? Yearly diagnosis will be coming in a secondary prevention, yearly admission, yearly treatment. Tertiary will be yearly treatment and rehabilitation. This is what naturally all the books are telling, right?
Yes, ma'am.
But I am just going to tell you something is a very beautiful thing. Rehabilitation should be begin the day one, not to wait when the person becoming disabled start with rehabilitation. For example, I am a 50-year-old woman. Now suddenly I diagnosed with hypertension. What may be the rehabilitation in the end result? Maybe my right side brain something happened, my BP vessels broken, my stroke will be coming. I will wait for the woman, me getting a stroke, you will rehabilitate me. So, you have to give information when I become diagnosed as a hypertensive. You have to teach me. You have to prevent it. So, prevention is better than cure. That principle you have to remember in the rehabilitation. You have to start your rehabilitation the day one the patient taking the BP tablet. Don't wait for the day you get for rehabilitation. For that you are not supposed to use the negative words. This is the concept. In America, one of my friend is there. This is the concept, but they do not know how to handle the situation, how to express to the girl. The girl is already depressed with 2 children in America. She delivered by herself. She was under the depression and she is taking care. Nobody coming because many people in India will take care during your pregnancy. With the stress she developed during pregnancy. That is called gestational diabetes mellitus. Once it is over, it will be cured 80%. But since your stress is increased, it's going to complete. The doctor called her, keeping this mind, you have to stop the woman getting cardiac arrest, or you know what are the 5 complications of diabetes? What is padi? Neuropathy, nephropathy, retinopathy. 5 padis are there now. So he wanted to tell her, but it is not the way to tell. He is telling, you are got diabetes. Another 1 year you will get hypertension, and afterwards you will develop all the disease. She got heart attack itself. My God, she is so depressed. This is not the way. Kota bol, you have to tell in a different way. The doctor is correct, but the delivery of the content is so negative way, desperately negative way. You have to tell the diabetes is not a first of all a disease for you to afraid. The diabetes is the imbalance between the insulin production and the insulin absorption. So you have to take care of yourself. There is a eustress and de-stress. Go for eustress, go for walking. You promote. There is a glass of water, dirty water is there. You cannot remove all the dirty water into your mind or something. Instead you can put the good thoughts. Slowly the dirty will be going. So you take it positively. I not get a disease. It's a disorder. And I will be all right. Let me change my diet. Let me change my exercise. There are good hormones are there. Happy hormones, serotonin, epinephrine.
Yes, ma'am.
Yes, oxytocin, when I hug, when I achieve. So these hormones I can improve. It will come. You believe it or not, 2 hours I have counseled her through my American call WhatsApp. Her life is totally changed. I told her to buy your own. You do work. You leave the children. You are the resilient woman. Without a parent, you can, why you are afraid of it? Two children or the something, you must be happy your children are active. There are some thalassemia, some drugs, vomiting people, vegetable baby, the baby will be lying down only. You want that kind of a baby, your life will go, your family life will go. Only Lilliputtu like a baby with Lilliputtu like a hand because of the side effects. Your baby is normal, IQ is normal, you are a resilient woman, you can do anything in your life. So totally her, the way what you told, you healthcare personnel, you keep the mind, the rehabilitation should be started from the day one the person is diagnosed with some disease, but the way of telling should be in a preventive way, promotive in a positive manner. How you can tell you are hypertensive? You can prevent stroke by controlling these medicines. Every 6 months, come for checkup. We will one or two we will change. Change your kitchen. Instead of one oil, you keep more oils. Only tail. What tail? What your tail you are using? Mustard oil. What you tell in Bengali? So that tail only everything. So you must have a sesame oil, you must have a groundnut oil, you must have a coconut oil. Variety you made it, HDL, BDL, LDL, triglycerides, all the cholesterol. Good cholesterol what is? Bad cholesterol what is? Nuts and this one is a good cholesterol. Improve. Cholesterol is needed. Every 1 gram of oil need 9 calories. But oil free you cannot. Oil is needed for the bones and ligaments, and the oil is needed for the body movements. Building the protein, oil is needed. Building blocks in our body, protein plus amino acids. You have to tell in a positive way, but one thing only will the long cholesterol is going. So change the items. So you have to tell, you can prevent, not tell you will get. How the doctor told here? You will get. You got no diabetes in this age. Another 2 years, you will get hypertension also. Your tablet has to increase. Then you will get because of this complication, you will get cancer also. Until cancer, he gave it. This girl, why I am living, feel like dying. So the healthcare professionals, what you are talking, make the person give a new life. You are busy, shut your mouth. If you are free, don't tell negative. Understand? That's called rehabilitation. Tell me the definition. What is the definition? Rehabilitation is a medical, social, psychological measure, train and retrain the individual and help him to live the maximum potential life with ability. Positivity. Okay. Write down the principles of rehabilitation. Types of rehabilitation. Can anyone tell what are all the types of rehabilitation before the principles? What are all the types? Medical rehabilitation, social rehabilitation, economical rehabilitation, psychological rehabilitation, vocational rehabilitation, what is the skill needed for rehabilitation? Communication skill, positivity skill, positively you have to speak, rehabilitation patient.
Yes, ma'am.
Right? Especially positive skill. Positive skill, communication skill, good listener you should be. Good listening skill. Write down. Good listening skill, counseling skill, problem solving skill, communication skill. Counseling. Counseling skill mainly you don't force them, you first listen. And counseling skill, write down, list down. And you have to tell pros and cons of each solution. Then they themselves will pick up the right solution. These are all the skills needed. Types of rehabilitation: vocational, medical,
Psychological,
speech rehabilitation also. Then economical rehabilitation. Some rehabilitation center and all, people will be doing mat making, candle making, pocket making, carry bag making. They are doing that. Right? What are all the principles of goals of rehabilitation? What is the goal? To restore. First, restore. What is restore? Improve is different. Improve, when you give medication, it will improve. Restore is the different. To restore the patient ability to function independently. What is dependently? One person is walking with me dependently. When I give him stick, independently he can get up and walk and go. So we are making, main goal is not treating, restoring. It's already he is having his potential. We are bringing out the potential from restoration to restore the patient ability to function independently as much as possible. Okay, next you write what are all the principles of rehabilitation. That is the first principle I tell you. Rehabilitation principle starts with the day the person you meet. Begins with the initial contact with the patient. He is already a patient. Why he is patient? He diagnosed with X or Y disease is called the patient. The first principle of rehabilitation is it should begin the initial contact with the patient. Either the diabetes, either the hypertension, either the small disease or bigger disease is the patient, you have to start, it's a initial. Don't wait for the disability to occur. The next point is should emphasize to restore the patient's independence. Principles of active participation. Principles of active. See, I alone will be shouting, the patient not responding. No, I have to give and take reciprocal relationship, partner. So, principles of participation is very essential principles. Principles of motivation. You are not supposed to talk like a doctor who talked in the America. He do not know how to handle the situation. Maybe true, the patient may get, but you have to tell in a positive way rather than the negative way. That's called the motivation. Principles of motivation. Principle of integration. See, very important principle is integration. You alone cannot treat the patient. If there is a one patient is there, medical doctor, neurosurgeon will be coming. Patient lost some food, done it, prosthesis doctors will be coming. Prosthetic experts will be coming. Physiotherapist will be coming. So you are the nurse going to be here 24 hours. You have to kotha bowl with everybody. You have to talk to everyone in a nice manner, irrespective of your patient. That is called integration. Integrate with various abilities into the one to the patient. Integration principle. Innovative principle. Principles of easy access. Principles of easy access. Realistic and meaningful. Realistic and meaningful. When Abdul Kalam has been called for to deliver some wheelchair or something to the people, he saw one boy running and his 7 kilo, 8 kilo prosthetics weight. So Abdul Kalam was shocked. He want to do something for this one. He has done lot of achievements as a scientist, as a national president, done many things. He is telling in one point of time, what I did for this girl is given me an immense pleasure. You can ask me, what did he did, madam? He was thinking that you have seen the flight. The kind of aluminium which they are using is light because so heavy metal taking off need lot of fuel. We are using a costliest petrol, white petrol. Even then, that kind of aluminium, he was telling something racket and some flying instrument what they are using. He made it little, nearly 7 kg weight into 400 gram light weight. He made kind of prosthesis And when the child is learning and when he restore his happiness, then he told, in my life I got an immense pleasure than achieving many things. This one given me pleasure. That is called the motivation. He used all the principles to motivate the child and to brought it easy access. He made it, it is easy accessible to, he talked with the companies and made it useful. Though process is useful, I can't afford it, then there is no use. It should be affordable. Our healthcare should be affordable. That's what. It should be realistic. It was once upon a time, it was not realistic. How that aluminium, but he made it realistic. So it is realistic, principles of realistic. Then principles of flexible and skilled workforce. Principles of skilled workforce. Okay, aims and objectives, same thing. Whatever you have to restore the ability of the individual, to help the individual to be independent, to prevent the disability. When you do rehabilitation, the person will not go for disability. Okay, the person ability will be improved and motivation can be given to the people. That are all this one. Okay, what are all the professionals needed for the rehabilitation? I told you who are all the professionals are there. Write down: doctors, nurses, speech therapist, vocational therapist, social worker, nurse, physiotherapist, social worker, psychiatrist, prosthetist, sports therapy, clinical psychologist. Prosthetist, sports therapist and clinical psychologist. What is the role of nurse? You have to write. So what are all the heading? If a 5 mark or 15 mark question is coming, you have to write the definition, principles, model. I have given the models and I have in my model, I think in my clear rehabilitation video, model is that stop and take the model. Then goal of rehabilitation, types of rehabilitation, people and principles of rehabilitation, goal of rehabilitation, then rehabilitation team members of rehabilitation, role of nurse in rehabilitation. First you have to assess the patient, formulation of the aims and objectives for them, and then you will be writing implementation of this one, and you will be evaluation and modification. Like that, like assessment, planning, implementation, evaluation only, you have to assess the patient. Immediately you cannot, but the patient day one diagnosis, you have to start your rehabilitation in a positive manner. In a positive words you have to start. You should not wait, so that the person will not go for the disability rehabilitation. That's about the rehabilitation chapter today. So you got an idea?
Yes, ma'am.
About what is rehabilitation in a detailed things. Separately I put on one video about it and I gave you the notes also. Please, this question has come, you have to write. 5 more questions will be coming about what are all the problems of the country, it will be coming. Then what is the communicable, list down the communicable diseases, it will come. List down the non-communicable diseases will be coming in India. I am just telling. Okay. And then nutritional problems in India, it will be coming. If you know the problems in our nation, then we can see what are all the programs Indian governments made it in a budget. Budget is very less only health care. Nearly 28% of the budget going for the military, because of we are in a threat of many countries, Afghanistan, Pakistan, Nepal, Bangladesh nearby, and Modi and Trump always, that Trump is a one idiot. He is playing with all country. He is not keeping quiet. He is like a businessman. He is not like a devotional leader, or no need to be devotional leader. At least he is come from the business family, his thinking is like a business, he's looking at India as a business. That cannot be. You should have a good relationship. So what's happening? This increase our tension. Any nations, he may, one thing he will tell, he will put a right indicator, he will put a left, he will show the hand, he will put the vehicle in the middle, like a kind of a stupid leaders are there. So all the nations, we have to put more budget for the military than the healthcare. Education also only 4%, they put healthcare only 7%. GDP was very, very less until Manmohan Singh has come for the action. In NRHM period, till before NRHM, family planning program, family welfare, MCH, only GDP was 0.9%. Out of 100 rupees, 90 paise is allotted for our healthcare. That time, 18 rupees allotted for military that time. Then military expenditure was increasing, Kargil war, many things has come. Then afterwards, Manmohan Singh, 2 rupees 45 paise. Now is 3 rupees 95. They increase that amount. But still, South India doing a wonderful job with that minimal health care. Our healthcare system is very, very excellent. Schooling, healthcare, medical, everything is the pakka we are doing. Midday meal also, it is come from our Chief Minister, Old Chief Minister K. Kamaraj, then pilot project and Tamil Nadu, and through that it is midday meal. Now every West Bengal also we are getting a food, right?
Yes,
so the midday nutritional program. So this is what community is so much interesting. One is related with another thing. So you should know how to present it. Clear? Okay. Here I am stopping. Tomorrow I will ask question about rehabilitation. Start with the new class.
Okay, ma'am.
Okay. Okay. Thank you.
Thank you, ma'am.
Anybody watch?
Yes, ma'am. 1, 2, 3, 4.
Morning 1:41 watch. How to go out?